because the doctor is in. The doctor is in right here on Qabayan Radio 94.3.
Live, online, on air, and on ground. Qabayan Radio 94.3.
The first and the only Filipino radio station in Qatar, Qabayan Radio 94.3. You're listening to Qabayan Radio 94.3, the first and only Filipino radio station in Qatar. We are taking radio to a whole new level. Qabayan Radio 94.3. Health is wealth. Ask about your health conditions. Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Qabayan Radio 94.3.
A wonderful evening, mga kabayan. You are tuned in to the first and the only Filipino radio station here in Qatar, Qabayan Radio 94.3. My name is Kenzo.
And my name is Tasha. Welcome to another episode of The Doctor is In. Right now, in addition to broadcasting this program on the airwaves, we are also streaming live on our Facebook page, and you can watch us by heading on to www.facebook.com/Qabayan943. And this program is also made possible by our partner, Family Medical Polyclinic.
All right, but before we introduce our guest partner for tonight, I would like to quote a Colombian novelist. His name is Gabriel Garcia Marquez, and he said, "Age is not how old you are, but how old you feel." So for my question to you who is listening or watching us right now, how old do you feel right now? Do you aspire to look or feel as if in the days of your youth? Tonight we'll discuss how aesthetic medicine challenges people's perspective in feeling young.
Yun na nga, Kenzo. And in this program, we will talk about approaches that we can consider to look and to feel young. We'll be discussing Botox, fillers, laser treatments, cauterization, and other skin conditions and treatments. And most exciting, we will be discussing some new procedures and new machines that are available at the Family Medical Polyclinic.
Right.
So joining us here in the studio is a GP dermatologist from Family Medical Polyclinic. I'm very happy to introduce you to Dr. Ethel Cajefe. Hi, Doctora.
Hi, good evening.
Good evening.
Magandang gabi po sa inyo. And of course, Dr. Ethel has been here for 8 years in Qatar, but with an overall experience of 16 years or more. So magandang gabi po sa
Magandang
pagsama sa amin.
gabi. Thank you for having me back.
It's good to have you back.
Yeah.
And though you were here before and you mentioned a little bit about yourself and how you got into aesthetic medicine, we would love to hear from you again. Just again, like a bit of a brief background about you and your journey to this specialization.
It wasn't really intended. It was not my intention to become a dermatologist, but I think it's fate. Because, well, there are a lot of considerations that I would like to enter aside from dermatology, but somehow it my experiences brings me to aesthetic dermatology, and I eventually liked it because how people feel about going to the dermatologist and how they feel better with their self, with how they look. So it's something that's also very fulfilling.
Perceptions and wants na din about, feeling and looking good. Gaano ba ka-open ang mga Filipinos in terms of, derma treatments?
Well, as I said before, nowadays Filipinos are really open. They aspire certain looks from the influence of other nationalities. So Filipinos specifically, they go as far as going through surgical procedures just to get what they want for themselves.
Pero ano yung mga common na mga skin concerns that Filipinos have? Nabanggit niyo po that, you know, they would want to aspire, someone maybe looking like a foreigner. Kasi nabanggit niyo yung cultural aspect. So is there anything that we Filipinos would really want to achieve? Gusto ba natin maging K-pop, yung mga
What are the
ganung
common
skin?
procedures that you usually find in their request?
Well, Filipinos really wanted to become lighter in color. No? They want to become whiter. So they come to the clinic to ask for procedures that makes them a bit fair. And then, of course, they want the nose. They're very particular with the nose. So, and also the kasi, diba, right now, the trend is to have bigger and plumper lips. So they usually ask for that as well.
I see.
Tumitingin tuloy ako sa nose tsaka sa lips ni Tasha.
Well, this is all natural from my mama. But since you mentioned a couple of those procedures, what else does the clinic offer? What are the other procedures? So you mentioned nga whitening. So ano pa yung mga whitening procedures na ina-offer ninyo at mga iba pa dun sa clinic?
For whitening procedure, we have different procedures. No, we offer mesotherapy. Mesotherapy is a form of whitening also. So we do inject to face, usually on face, to make your skin lighter. Also, there are machines that we use to lighten the skin. There's carbon laser, Q-switch, or fractional laser. These are all procedures that can help you lighten your skin.
Wow.
There's also chemical peel.
Ang
So,
daming procedures. There are a lot of options to choose from kung paano mo gustong maremedyohan yung mga concerns
To
mo
lighten the
on your skin.
skin.
But what are the recommended, you know, treatments on maintaining youthful appearance? Meron po ba yung parang medyo bumata ang age natin?
Well, young, it really depends on individuals. Like, you have to look at the profile of the patient. So, if the patient started having nagsasaging skin as early as when they're still young, then you can already do certain procedures that involves injections like fillers or Botox. It will help. Of course, you can maintain with a regular cleaning of the face, because cleaning alone of the face can make you look young, kasi it maintains the cleanliness and the appearance of your skin as glowing and more radiant. And then there are other procedures that you can do to look young aside from the injections. There's a new. It's not really new. It's been around for a long time, but recently we are offering it now in the clinic. It's called thread, if you're familiar with it. Now, thread is this is a procedure. It involves sutures, the ones that we use for surgical suturing. So this can also lift your face. There are different kind of threads, and depending on what you need, procedure like lifting of your face. It can even be used for scar reduction, for tightening of the skin. So these are the new treatments we have in the clinic.
Ang dami nang nabanggit ni Doc na procedures and treatments, and we're gonna focus on a number of these treatments and procedures a little later. Pero Doc, before we proceed, tanungin ko muna, meron bang specific na difference between treating men and women?
Well, there are difference, but with treatments, what women can do, men can also do.
Okay.
The difference only is that, like, for example, with Botox, because that one will tighten your skin, it will relax your muscles. The women has softer muscle compared to men.
So mas maraming
So yeah,
Botox.
men tends to have more a number of injections of Botox because of the structure of the muscles. So yun lang naman yung mga small. And for men, there are more men who are more concerned about yung sa hair, mga receding hairlines, mga hair falls. But women can also do the treatment with
PRP po ba yung treatment?
Yeah, we have mesotherapy and PRP,
Okay,
yung plasma-rich protein. So these are procedures for hair.
Balikan muna natin, Doc. May nabanggit kayo kanina na isang treatment and it's something that I'm not very familiar with yet. Hindi pa natin ito napag-usapan ng mga karaang editions ng The Doctor is In. It is something about threading. Can you please further explain po kung ano nga ulit yung threading?
Well, yung threading has been around for a long time naman na. But it didn't get the popularity unlike filler. It's because before yung thread, they are non-absorbable or they don't dissolve. So you will notice from before when you do thread, you can see the threads here. Tapos when you need to add, when the skin starts to sag again, you have to add more threads and it will not dissolve, it will still be there. Now the threads are absorbable, they can be dissolved.
Okay.
So these are the same threads used for surgical suturing.
Okay.
So,
Doc, clarify ko lang, itong thread po na ito, parang naglalagay ng thread para ma-lift yung face.
Para ma-lift.
Alright, so just to avoid confusion, baka iniisip na iba yung threading.
Yung threading na nagtatanggal ng buhok, yun yung
Yeah.
alam ko din eh, yung gumaganon-ganon, yan, yung
So,
ganong klaseng threading. But yung sinasabi nga ni Doc is the medical sutures which are used and then now it's absorbable. I actually have a follow-up question to that. What would be the preparation for someone who wants to get this procedure done? Is there anything that needs to be done beforehand, or could someone just walk into the clinic and say, I want to get some threading today, and then how, yeah, so what would a person need to do?
Well, the thread, you walk in, and you just tell the doctor what is your concern. And not everyone is candidate for lifting of thread. But there are 3 kinds of thread that could be suitable for you. Yung, well, there's cog, there's mono, and there's screw. So when we say cog, yun yung usually the long threads that we use for lifting. So not everybody needs lifting naman. The other 2, like the screw and the mono, they are for tightening. So basically everyone can do the tightening, and for scar reduction also. Kasi because of the thread, when we insert it, it produces collagen then and elastin. So what happens, still because of the wounding, it produces more collagen. So na-build up yung scar, so nagkakaroon ng improvement. Also, for tightening, yan yung mono thread.
Okay.
But the cog, this one is the one that's really used for lifting.
Right. Okay. So basically, ang ginagawa ng threading is para ma-lift ulit yung
Para
skin natin.
ma-lift,
Kasi,
yeah.
nagsasaging skin dahil of gravity na din, di ba? Talagang bumababa. So, we need to, make some adjustments after
I feel like
a number of
Kenzo is really
decades.
he's like thinking of the different threads. But so
Yeah.
someone goes in and then they ask for the procedure, and let's say they are a candidate for threading. What would be now the next step, and how long would the recovery take?
Well, it's also an office procedure, but it involves like injection of anesthetic injection. So the area has to be sterile because we are going to be putting foreign body in your skin. So basically, the thread goes in your skin, and then it lifts it. So because of this, anything that you put in your skin, the surrounding has to be sterile.
Right.
So ideally din naman, with any procedure that you do, I would suggest that you stop using yung mga retinols 3 days before. And it's only because your skin is more sensitive with retinol. So when you do certain procedures, they tend to be more burning and sensation.
Okay.
So there is a little bit of discomfort. Only for that reason. Pero there's no problem naman if you're still using the retinol. And basically, there's not much preparation. You just come, and then it's as I said, it's an office procedure. Side effect that you might witness or see are just bruises, which is normal with any form of injection.
Right.
Because this is also injection. We use needle to insert the threads.
Okay, so we're gonna talk more about threading a little later and of many other procedures that you can actually avail of sa Family Medical Polyclinic. And of course, makakasama pa rin natin, walang iba kundi si Dr. Ethel Cajefe. Once again, only here on your Qabayan Radio 94.3.
Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Qabayan Radio 94.3.
The current time is 7:32.
This time check is brought to you by Gulf Dental Center, where beautiful smiles are created for you and your family. Gulf Dental Center, Airport Road, now offers a comprehensive rate for filling the interior from the starting rates of 100 Qatari Riyals and filling the posterior for starting rate of 150 Qatari Riyals with normal extraction for starting rate of 150 Qatari Riyals, scaling and polishing for 250 Qatari Riyals, and root canal interior for 500 Qatari Riyals. Visit Gulf Dental Center, Airport Road or call 7795-6366. You're in good hands with Dr. Alisa Cabarubia. For any information, please call 4411-3556 or visit Family Medical Polyclinic or Care in Al Azizia branch.
With more than 257,000 unique audience and more than 60,000 followers, Qabayan Radio, Qabayan Radio 94.3 FM is the best. It is the best marketplace for your advertisements. For inquiries, please contact our sales and marketing department at 44994944 or email info@qabayanfm.com.
Live, online, on air, and on ground. Qabayan Radio 94.3.
The first and the only Filipino radio station in Qatar, Qabayan Radio 94.3. Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Qabayan Radio 94.3.
Live, online, on air, and on ground. Qabayan Radio 94.3.
The first and the only Filipino radio station in Qatar, Qabayan Radio 94.3. You are listening to Qabayan Radio 94.3, the first and only Filipino radio station in Qatar. We are taking radio to a whole new level. Qabayan Radio 94.3. Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Qabayan Radio 94.3.
And we're back with the doctors in with Dr. Ethel Cajefe. Thank you once again. And so a while ago, we were discussing a couple of things.
Yes, kasama ni John, of course, what are the common skin concerns that we Filipinos do have? At nasimula na rin natin na pag-usapan kung ano nga ba yung threading. And of course, this is a face lifting procedure. And we discussed about the preparations, kung paano nga ba tayo maghahanda bago yung procedure na yan. So ngayon, Doc, pag-usapan lang natin, during the procedure, earlier you mentioned about, having to use pampamanhid, kumbaga anesthetic. Kapag ginagawa na yung procedure, gaano po usually katagal itong procedure na ito?
Well, the procedure is fast, but it depends then how many threads do you need. Pero usually it lasts from as fast as 30 minutes, maybe to an hour, like that.
And then after the procedure, they can actually go and proceed with their normal activities.
They can proceed with their normal activities. But of course, as I said, because this involves injection, you might get bruises.
Okay.
So you just have to be prepared. Sometimes you get these bruises.
And how long is the recovery time, though?
The recovery, within the days, like 2 or 3 days, you should be okay. But from 3 days to 2 weeks.
I see.
So it still depends.
And how long before you see the effects of the threading?
Well, the effect is immediate.
Wow.
You will see it immediately.
Wow.
Because at once it gets lifted because of the thread.
Okay.
So actually, usually what we do the one side of the face first so they can compare the improvement.
Okay. And how long does this effect last? Kasi nabanggit niyo po that the thread is actually something that dissolves over time. So how long is the effect of these threads?
Well, for cog threads, those are for lifting, no? Usually they last like a year.
Okay.
Sometimes they last longer,
Okay.
but on average, 1 year or 1.5 years like that.
And they have to go back to you.
They have to go back to
lagyan
do
ulit
it,
ng
yeah,
threads.
to do
Okay.
it again.
Okay.
And are you familiar with thread lifting for nose? Well, we don't have that in the
Okay.
clinic for
Yeah.
now, but there is one
Right.
that's very famous right now called haiku.
Yeah.
Haiku.
I do have a friend who did that back in the Philippines.
May
insert ng mga threads,
It's still
That's
thread.
interesting.
It's
I've
also
actually
thread.
never heard of the one for the nose before. But hopefully, maybe the clinic will get that soon. I'm sure that would be a popular one.
Yeah, para sa mga Pinoy, ano?
I do have to ask though, with these procedures, especially with threading, specifically, is this okay for women who are planning to get pregnant or also mothers who are breastfeeding? I mean, what would you recommend?
It's not a contraindication if you're breastfeeding or if you're planning to get pregnant, because this is just absorbable suture. So even with pregnancy, you can get these procedures. We just have to be careful with the anesthetic. Yeah.
I see.
All right.
Okay, thank you.
And actually, isa pa sa mga pag-uusapan natin ngayon, di ba? Apart from the threading, the face lifting, ay yung threading naman for the hair.
Threading for the hair,
Yeah,
yes.
and you have this something called Clarity na machine or procedure that you do have in your clinic.
Clarity is a hair removal machine. It's basically same like what we have before, Candela. It's also by Candela. The only difference is that now they have what they call IntelliTrack. Same like artificial intelligence. So what happens is the procedure is faster. So instead of usually for full body, it takes us 1 hour to finish the full body laser hair removal. With Clarity, it will only take 30 minutes, and that's because of this innovation, the IntelliTrack.
Wow, grabe ang innovation,
Wow.
ano?
Yeah.
Even the body hairs kaya niyang may artificial intelligence na ginagamit.
Wow.
So, what's the benefit of Clarity compared to the other procedures that you have for laser hair removal, apart from the shortened time?
There is less irritation. There is less chance of getting burned, because usually before the IntelliTrack of this Clarity machine, it makes sure that the gaps between the laser will be enough not to burn your skin, and that's because of the artificial intelligence. So less downtime also.
And so just to clarify as well, with regards to the pain factor, do you hear feedback that this machine is a little bit feels a little bit less painful when used on the skin rather than the other laser treatments, or is it almost the same?
Almost the same. It's just that because of the shortened time, you will suffer less.
I see.
But it's not really painful.
It's not really painful.
Okay, that's
Yeah.
good to know. So is there anything else that you would like to ask about Clarity and laser hair removal before we jump on to the many other topics that we have?
I think I guess for Clarity, I'm curious because you mentioned the artificial intelligence. So when you say the whole body, is this machine already used in the entire body, or really just the parts in which are exposed?
Wherever you have hair, you can do laser hair removal. So practically, it's really whole body.
Wow. But how much does this cost? I'm sure many of the viewers would want to know, I would want to consider this procedure, but, I want to know how much will it cost me to undergo this type of
Well, with regards the price, I think it's the same with the regular machine for now.
I see.
With the regular, so
But
it doesn't differ.
Is it a one-time procedure, or you have to go back 2 or 3 times in the clinic?
Removal is a continuous procedure.
Okay.
You have to do it every month. The earliest
Okay.
time you can redo it again is after 3 weeks. The latest is 2 months, and you have to repeat it 4 or more sessions. It depends how your hair reacts with the machine. But most of the time for Filipinos, the good news is in Filipinos, they react well with laser hair removal. Sometimes 4 sessions is enough.
Okay.
Yun. So 4 sessions like 1 month apart.
Okay, that's good to know. Anyway, we'll just go on a very short break for a technical concern, and then we'll be having more topics, of course, together with our guest from the Family Medical Polyclinic, si Dr. Ethel Cajefe. So keep your frequencies locked in only here on your Qabayan Radio 94.3.
Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Qabayan Radio 94.3.
The current time is 7:42.
This time check is brought to you by Gulf Dental Center, where beautiful smiles are created for you and your family. Gulf Dental Center, Airport Road, now offers a comprehensive rate for filling the interior from the starting rate of 100 Qatari Riyals and filling the posterior for starting rate of 150 Qatari Riyals with normal extraction for starting rate of 150 Qatari Riyals, scaling and polishing for 250 Qatari Riyals, and root canal interior for 500 Qatari Riyals. Visit Gulf Dental Center, Airport Road, or call 7795-6366. You're in good hands with Dr. Alisa Cabarubias. For any information, please call 4411-3556 or visit Family Medical Polyclinic, Care in Al Azizia branch.
With more than 257,000 unique audience and more than 60,000 followers, Qabayan Radio, Qabayan Radio 94.3 FM is the best. Is the best marketplace for your advertisements. For inquiries, please contact our sales and marketing department at 44994944 or email info@qabayanfm.com. The first and the only Filipino radio station in Qatar, Qabayan Radio 94.3.
Live, online, on air, and on ground. Qabayan Radio 94.3.
You're listening to Qabayan Radio 94.3, the first and only Filipino radio station in Qatar. We are taking radio to a whole new level. Qabayan Radio 94.3. Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Qabayan Radio 94.3.
Still tuned in. You're still tuned in to Qabayan Radio 94.3, and this is The Doctor is In. Of course, kasama ko ang aking partner na si Tasha and ang ating guest for tonight na si Dr. Ethel Cajefe of the Family Medical Polyclinic. And earlier, we were talking about yung threading, which is the face lifting, and at the same time, yung clarity, which is the laser hair removal treatment.
And we are going to talk about more procedures because I'm sure yung mga nakikinig ngayon at nanonood, they definitely would love to know about the other things that the clinic is offering to make you feel and look younger. So, isa dun sa mga it's quite known, but at the same time, I'm sure marami tayong mga tanong about Botox. What can you tell us about Botox, Doc?
Well, Botox is really a wonder. It gives you a lot of confidence because, for one, the reason why we feel like we age is because of the development of the wrinkles. And so far, it's only Botox that can address that condition. So because it relaxes the muscle, it practically erases the wrinkles in our face. So it lessens a lot of age in our looks.
Right? Lalo na dito sa may bandang eye
Crow's
area
feet,
at saka sa forehead.
Yeah.
And actually, I wanted to follow up because we talked about Botox before din, no? Pero pwede din yan sa mga women who are planning to get pregnant or those who are pregnant or nursing mothers.
Well, we don't advise it to women who are pregnant. But those who are planning to get pregnant and nursing, it's okay. Because there is no study that the Botox gets to the breast milk. So it's okay. But with pregnancy, we have to be careful. So usually we don't do too much procedures with pregnant women, even with laser.
And of course, Doc, with Botox, this is also a very fast procedure, di ba? Parang you're just gonna inject the Botox and pwede ka nang lumabas ng clinic at okay na. But,
Actually, kahit 10 minutes, kaya yung Botox.
yeah. But how long does the effect, take? I mean, yeah.
Well, if it's your first time to do Botox, usually the effect is only for 3 to 4 months.
Okay.
Then you have to repeat again. But if you've been doing it for quite a long time, usually it lasts 6 months or 8 months.
I see. And,
Okay.
and around what age
Do
should
you
someone
can
start?
Well, as early as when you see signs of na wrinkling, you can already start doing Botox. Some even if they're still young, they want to lift their eyebrows. Botox can also do that because it relaxes the muscles. So there are certain points in your skin which when we inject with Botox, it relaxes and it lifts the eyebrows. So these are other procedures aside from wrinkles. Where Botox is helpful.
Actually, you asked a very good question about the age. Kasi, I don't know, Doc, please correct me if I'm wrong, but I've heard from someone na mas maganda daw to start with Botox at an earlier age, yung kapag nagsisimula pa lang talagang lumabas. Kasi it already means that you're preventing your skin from having wrinkles as opposed to kapag ka medyo may edad na at grabe na yung wrinkles mo, mas mahirap siyang i-treat. Tama po ba, Doc?
Yeah, because the deeper the lines, the more difficult it is to be removed by Botox. So once you do Botox kasi, it prevents you from using your muscles. And the use of muscles, these are the reason why we are developing the lines. So when we do Botox, the muscles are relaxed and tightened. So whatever you do with the muscle, it's not going to move anymore. So less chances of developing more lines.
Okay.
So it's preventive in a sense.
Wow, okay.
So pwede na tayong pumunta mamaya. Hanggang oras ba, Doc, yung clinic niyo? Hanggang 9 tapusin na natin yung program natin. But anyway, that's Botox. Pero another procedure na sinasabi nila na pwedeng makapagpabata sa atin to have that youthful appearance is yung fillers. Ano po yung fillers and how does it differ with Botox?
Yeah. The fillers are different from Botox in a sense na yung filler, these are more for plumping, for adding volume. Well, as we age din kasi, we lose a lot of collagen in our skin and the natural component is hyaluronic acid. We also lose it. Fillers are hyaluronic acid, so it replaces the lost hyaluronic acid that we lose when we age. So, kunyari, nag-start na mag-deepen yung, nagsasag na siya ng konti, it's because you need to plump it with filler also. Tapos yung mga deeper lines, filler addresses that. If you want thicker lips, we can even use it for nose lifting then, yung filler. But temporary, so it will last for a year also.
Okay.
Mga 6 months to 1 year. Now, recently, there's also a new development with hyaluronic acid. They are not just used as fillers. May hyaluronic acid din na ginagamit for lifting. So these are different kind of hyaluronic acid in a sense na it's not the cross-linking of hyaluronic acid. This is the reason kung bakit siya nagkakos ng volume. Now, this kind of hyaluronic acid is not cross-linked. So, spread siya sa skin natin. So, what it does, it adds glow to our face and it lifts our skin. So, these are a different kind of hyaluronic acid. It's called Profilo.
Okay.
I'm not sure if everyone is familiar with it, but these are really promising treatments, and I have a lot of patients who's really into it because they see the effect immediately as well.
Oh, wow. And this is something that you also offer in your
We
clinic?
also have in the clinic.
And how about the procedure, Doc? Yung procedure ba niya is similar to Botox then?
Yeah, it's also by injection. It's a 5-point injection, 5-point on the right and on the left. Basically, it's also, since it's also by injection, you might also get bruises, but it's a very minimal downtime, and not everyone gets bruises. Yeah, and it's less painful because you only have 5 points to inject.
I see. Doc, kasi the word fillers in itself, some people might think that it's filling up the face. So what about those who want to look slimmer in their face? Are the fillers also recommended for those who want to look
Parang ako yata yung kailangan nun.
for those who want to look slimmer nga. I didn't point naman fingers. But...
No, I'm just saying it because a friend of
Ako
mine told
din
me,
eh.
ang laki ng pisngi mo sa camera. Magpapayat ka nga. Anyway, Doc, sige, to answer the question.
Well, yung fillers, sometimes you can use it not really to lessen yung face, but it gives the appearance that your face is a little smaller.
Okay.
Because what you can do with filler, you can actually restructure your face.
Yung shape.
So yeah,
I
the
see.
shape. So we can put it here. May sinasabi silang Nefertiti, yung sinishape nila yung jawline
Yes.
to become more obvious yung jawline dito. And then you can also add filler on your chin. So when your face is more shaped like this, it looks slimmer.
I see. Okay.
But aside from filler, you can do machine treatments to lessen the to slim the face as well. Pero pwede ka rin ng mesotherapy because the good thing about mesotherapy, we can add different vitamins that will help with whatever is your intention or what you want to address. So there's also certain vitamins that can tighten and slim the face.
Wow. Okay. And these are injectables?
These are injectables.
Okay. I would actually want to ask more about therapy a little later, pero balikan ko lang ulit, Doc, yung sa fillers and sa Botox. Earlier we mentioned that Botox would usually have an effect for 4 months pagkabago pa lang, and then if you've been doing it for some time, the effect could be 6 months. How about with fillers po?
Well, the fillers, it's fixed. It could last from 6 months to 1 year, sometimes longer than 1 year.
Okay.
Dependent naman yon sa exposure to heat. Because hyaluronic acid tends to dissolve with heat. So if you're always you're always under the sun, if you love taking hot water shower or steam bath,
I see. Lalo na with the weather here in Qatar, no? Baka medyo mas malesen yung At dapat hindi pala sa sauna, yung mga ganyan,
Or dapat nag-ice wash
Yeah.
na lang ng face instead of warm water, no?
Yes.
Okay.
But
Well, warm water is okay as long as it's not hot.
I see.
Pero saan po napupunta yung mga in-inject na yun? Kapag
It dissolves.
Okay.
Natutunaw lang talaga.
So it's
napupunta siya sa
flushed out.
waste.
Yeah.
It's
basically.
flushed out of the body. Okay,
Nice.
that's good to know. And nabanggit nyo din po kanina, yung mesotherapy, ano po ba particularly ang ina-address nitong procedure na ito?
Yung mesotherapy naman, there's a lot of use of mesotherapy. As I said, you can use it for skin. It's for skin rejuvenation. Well, we have 2 kinds of mesotherapy now. We can either do it with direct injection or with the use of dermapen. Yung dermapen. So the dermapen also addresses scars. Kasi as I said, kapag winuwound mo yung skin, the more collagen is produced. So isa yun sa na-address. Another one, well, yun nga, skin rejuvenation. We also have mesotherapy for the hair, which will help with the regrowth of the hair, yung mga nagkakaroon ng problem with alopecia or certain hair fall. And whitening, it can also be used for whitening, as I mentioned earlier, for those. It's also to keep you young looking.
So ito po ang mesotherapy is also the same as yung sinasabi natin na microdermabrasion or still something different pa?
It's something different. Yung microdermabrasion, these are machines that we use parang basically to, as the word itself, no, it causes abrasion to your skin.
Right.
Para ganun pa rin, mag-form ng more collagen.
I see. Kasi you
So it
mentioned,
gets
Doc,
renewed.
earlier that during the mesotherapy, gumagamit ng mga needles, a lot of needles to scar the skin para magkaroon ng rejuvenation. How about with microdermabrasion? Ibang klase pa po ba yung treatment na yan?
Yung microdermabrasion naman, it's a procedure that causes abrasion to the skin. So, parang sanding. Parang sinasand yung skin mo para matanggal yung dead skin. At the same time, yung sanding by itself causes also production of collagen.
I see. Okay.
So these are, if you're familiar with diamond peel or crystal peel, these are
Okay.
microdermabrasion procedures.
I see. Okay. So which one is better for reducing acne scars? Kasi very very common sa Filipinos din yung nagkakaroon ng acne, di ba? So which is the procedure that would be best to reduce yung mga acne scars?
Most of the time, you have to consider din yung lifestyle ng patient. Because you have to consider also the downtime. Pero it depends yung microdermabrasion like diamond peel or crystal peel. It could be enough if combined with other treatments. Usually you can combine it with chemical peel to help reduce the scar. Pero there are other procedures kasi that you can do to reduce the scar aside from microdermabrasion, like yung fractional laser is another form of treatment for scar reduction. Well, pati na rin yung yung microneedling.
Right. Okay. Okay. But usually, how long does the procedure take on both po, no? Yung sa mesotherapy tsaka sa microdermabrasion, gaano katagal po yung mga procedures nitong mga ito?
Usually, it lasts like 15 to 30 minutes lang.
Okay.
Pero, well, you have to prepare because yung microneedling, we have to apply anesthetic cream. So, it will take additional like 10 to 15 minutes before the procedure.
And how many procedures, how many treatments does a person need? Or depende po ba yan sa kaso?
Depende sa kaso. Pero it's always minimum of 4 sessions. Kasi you will not see the effect immediately in one sitting. The first effect would always be glowing of the skin. Your skin will start to glow. Tapos susunod na yung, kapag continuous yung treatment, it gets, you tend to produce more and more collagen, so nagkakaroon ng pagbabaw na ng mga scars.
And in between those sessions, gaano po siya katagal?
You can do it as yung microdermabrasion and even mesotherapy, no? You can do it as often as every 2 weeks.
Okay.
Every 2
2
weeks.
weeks.
So, kunyari, Doc, nagmamadali yung patient. Yung tipong gusto nila within a certain period of time, mawala yung scars nila. What would you recommend usually for them kung ganon?
Yeah, but there is no such thing as yung instant or fast removal of scar. You really have to be patient. Kasi yung interval alone, which is every 2 weeks, it will already take time. So, siguro, you have to prepare at least mga 4 months or longer before you see result.
Okay. Good to know, Doc. Para yung mga, yung mga
Naiinip.
tsaka yung nagpre-prepare for an event
Yeah.
or wedding or ano
Yes.
man, di ba? So, isipin nila, nako, malapit na, may pupuntahan sila. So, 4 months
Yeah.
before, at least, they should be going to the
Yeah.
clinic to
And also, I will
get the
suggest,
procedure.
because you mentioned that, no, yung sa mga fillers, I always suggest that if you want to do it and you have an event, do it at least 2 weeks before. Para you can follow up, you can see if there is something that we have to redo for follow up, or if you have like bruising, at least it will take time to heal before the event.
Okay. All right. That's
Thank you,
good to know.
Doc. Yeah, good to know.
All right, now we're gonna talk about the last procedure na pag-uusapan natin ngayong gabi na ito, and this is about cauterization. So, Doc, ano po ba ang cauterization?
Well, cauterization, basically, it's burning, just burning. No? It's a machine that we use to burn yung mga excess growth in our skin. So these are warts. You can also cauterize mole. There's also molluscum. These are similar with warts. There are lentigens, or we have liver spots, yung mga age spots. So any excess growth of the skin, mga skin tags, this can all be removed with cauterization.
Is this very common to Filipinos?
Very common with Filipinos, especially kasi marami talagang Filipinos who come in the clinic with warts. And the good thing about the wart removal or cauterization, it is covered by your insurance. We have insurance.
Yes.
Because basically one of the thing that it treats is yung warts, and warts is infectious because this is virus. So because it's infectious, the insurance will cover the procedure.
Ayan, good to know.
Actually, magandang balita yan, for everyone who's considering na magpa-cauterize ng kanilang mga tawag dito?
Ng warts.
Warts
or
and all,
any
yeah.
excess
You can
growth.
actually use your insurance if you have one. And binanggit niyo, Doc, diba, ang cauterization means talagang burning the skin, diba? So does it create like mga scars.
Yeah,
and
it does, but it's only temporary. Like if for the face, usually the scabs will only be there for 7 days. And as long as you're not exposed to any form of heat, it will go on its own, by its own. Pero kapag ka na-expose ka sa araw, ganun ulit, nag-hot water shower ka, yung mga marks becomes permanent. So you have to be careful.
Okay.
Okay.
So just give us a little bit of like a aftercare for the cauterization.
For the cauterization.
Let's say merong pupuntahan or again, someone has to go to work the next day. What would you recommend sa mga gusto magpa-cauterize?
First you have to prepare, no, na, for the next 7 days you won't be exposed to sun. Otherwise, it's going to be a problem for you kasi magli-leave talaga siya ng marks. But we give them antibiotic creams para the healing is faster and it won't get infected. So you have to use this for 7 days to 2 weeks and then use sunblock all the time. So when you go out, the exposure to sun is less. But even if you're wearing sunblock, you still have to avoid direct sun exposure. And then you are not allowed to wash your face for the next 24 hours lang naman.
Okay,
Or
24
the
hours is
area.
okay.
That's
yeah.
good to know. Ang dami natin ng pag-usapan ngayong gabi na ito. We talked about threading, we talked about yung laser hair removal, we talked about Botox, derma fillers, microdermabrasion.
Microdermabrasion and mesotherapy.
Right, and
Yes.
also cauterization. Is there anything else, Doc, that you would like to add na mga treatments na pwedeng i-consider ng ating mga nakikinig or nanonood and, treatments that are available in your clinic?
Well, everything that we discuss, it's actually available in the clinic. So we have laser hair removal machine, we have carbon laser or Q-switch, we have fractional laser, we have mesotherapy, we have PRP, Botox, fillers, threads right now, and among others, which I might have forgotten.
Okay. That's good to know. How do they get to be in touch po sa inyong clinic?
They just have to contact the clinic. You can call the clinic.
We're gonna put in the
Yeah,
numbers
okay.
here at the
contact
bottom of the
numbers,
screen
Yeah.
or sa comment section natin. And also, saan po located ang inyong clinic?
Yeah, we are located in Al-Waqir, Al-Mashaf, so Family Medical Polyclinic.
All right.
And opening hours?
The opening hours is from 9 a.m. to 9 p.m.
From dire-diretso po
Yeah,
siya.
dire-diretso, pero the clinic is closed on Fridays.
On
And
Friday.
on Thursdays, we're only open from 9 to 5.
Okay.
Okay.
So, on Thursdays po, 9 to 5, but on any other days, it's from 9 a.m. to 9 p.m. except Friday. Punta lang po kayo dyan sa Family Medical Polyclinic for you to book an appointment. Actually, tumawag na lang for you to book an appointment at magawa na yung mga gusto nyong procedures on how to look younger, diba? And how to address some of the skin concerns that you do have. Is there anything else, Doc, that you would like to add this evening?
Well, we do give special prices for Filipinas, so
Okay.
you have to
Ayan.
watch out for that and come and visit us, so you will find out more about it.
Meron po kayong on air na din?
To all the staff of Family Medical Polyclinic, especially in Al-Waqir, all the nurses, derma nurses, and all our bosses, Mr. Muhammad and Dr. Mahmoud, for again giving us this opportunity to explain to our kabayans the treatments that we have in the clinic.
All right. Once again, thank you very much, Dr. Ethel M. Cajefe, for joining us here in the studio. And on behalf of Qabayan Radio, I would also like to thank Family Medical Polyclinic for making this episode of The Doctor Is In possible.
Yes, and it has really been a pleasure to have you here with us, Doctora. And it is a pleasure to be able to speak with such an expert on how we can maintain our youthful appearance. And I would like to say that it is truly important to feel confident all the time. And part of being confident is looking young and feeling young in order to feel that we are always ready to face the world. So more importantly, I like to quote Priscilla Presley in this, inner beauty should be the most important part of improving oneself. But of course, when we want to have these procedures done, we have the wonderful Doctora Ethel Cajefe and the family medical clinic where we can go for these procedures. So thank you very much for joining us.
Thank you.
Thank you, Kenzo.
Yeah, thank you.
Thank you.
And once again, kasama po si Tasha at ako si Kenzo. This is Qabayan Radio 94.3 for The Doctor is In. And as always, stay safe, keep smiling, and be blessed.
Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Qabayan Radio 94.3.
Gulf Dental Center, Airport Road, now offers a comprehensive rate for filling the interior from the starting rate of 100 Qatari Riyals and filling the posterior for starting rate of 150 Qatari Riyals with normal extraction for starting rate of 150 Qatari Riyals, scaling and polishing for 250 Qatari Riyals, and root canal interior for 500 Qatari Riyals. Visit Gulf